What is the difference between arcuate scotoma and hemianopsia? Imagine looking at a bright, clear window and suddenly noticing a curved shadow or a large missing section in your vision. These are clues your eye health professional uses to understand what might be happening inside your eyes or brain. Two common types of visual field defects are arcuate scotomas and hemianopsias, and they tell us different stories about where the problem lies. An arcuate scotoma is a small, curved blind spot that follows the shape of the nerve fibers in your retina. It usually appears near the blind spot and extends outward in a bow shape. This type of defect is often linked to damage in the optic nerve head, especially in conditions like glaucoma. Glaucoma damages the nerve fibers that carry visual information from your eye to your brain, and arcuate scotomas are an early sign of this damage. During a visual field test, an arcuate scotoma shows up as a curved area of vision loss that respects the horizontal midline, meaning it stays on one side of your visual field and does not cross over. On the other hand, hemianopsia involves a much larger area of vision loss, typically affecting half of your visual field in both eyes. This can be on the same side in both eyes, called homonymous hemianopsia, or it can be in the upper or lower halves, known as quadrantanopsia. Hemianopsia results from damage in the brain's visual pathways after the optic chiasm, such as in the optic tract, the optic radiations, or the visual cortex in the occipital lobe. Because of this, hemianopsias usually cross the vertical midline, affecting the same side of the visual field in both eyes. The key differences are in their location and what causes them. Arcuate scotomas are small, localized, and confined to one, following the nerve fiber pattern. They are often an early sign of optic nerve problems like glaucoma. Hemianopsias are much larger, affecting half of the visual field in both eyes, and indicate neurological issues like stroke, tumors, or trauma affecting the brain's visual centers. Eye health, detecting these defects through visual field testing, helps doctors figure out where the problem is. An arcuate scotoma looks like a curved blind spot respecting the horizontal line, while a hemianopsia appears as a large half-field blind spot crossing the vertical line. Recognizing these patterns is crucial because they guide diagnosis and treatment. If a small arcuate defect is found, it might mean early glaucoma, which can often be managed with eye drops or other treatments. If a large hemianopsia is detected, it could mean a neurological event like a stroke, requiring different medical intervention. Always remember, if you notice any changes in your vision or have concerns about your eye health, it is essential to consult an eye care professional. They can perform detailed visual field tests and help determine the cause of any visual field loss. Understanding these differences helps us appreciate how our eyes and brain work together and why early detection is so important for maintaining good vision.